Hey guys, welcome to another video on dry needling. Today what we're going to be doing is we're going to be needling Jasmine's shoulder. Specifically, we're going to be going for her upper trap. So the upper traps come from, well, we have a skull here. We come from the skull right down to the side of her shoulder blade. We'll do left side and the right side and see if we can get a little bit more range of motion through her shoulder. Alright, so we got Jasmine here. Can you have a lie after me, please? Excellent. Okay, so same thing as before. We're just going to clean off the shoulders. Upper traps again comes from the base of the skull, comes right to the side of her shoulder, and we're going to start here on the right side. Now the thing for the upper trap, what we need to look out for is at the very base here, at the top of the shoulder blade, or at where the collarbone is. Her lungs do come in that area, so we have to make sure that we stay away from any vulnerable areas like the lungs. So what we're going to pinch the shoulder so that we can pull it away from the chest wall. You can see that little ropey segment of her upper trap. And what we're going to do here is just take the needle, poke it in, get that hair out of the way there. And once we do that first pass, you feel a little bit of a twitch there already. You actually feel her shoulder twitching right to the neck there. How's that feel, Jasmine?
That's okay.
Yeah, it's okay. And that was one. So because it's pretty thin muscle up here in the upper trap, we're only using a small needle here, about 30 millimeters or 3 centimeters. What's that? Just over an inch. So again, we'll do a few spots here. Grab, pinch, poke. First pass. And a few big twitches. So the upper traps are one of those muscles that you really get some nice twitches out of. For most people anyways. And again, because it's such a thin needle, unless we nick a blood vessel, there's no blood that comes out of here. So Jasmine's had this done for a few sessions now. I mean, how's it feel generally after your needling session?
Pretty sore afterwards, but after the soreness it gets better. It loosens up.
And Jasmine's a hard worker, so she's always got sore and tight upper traps.
Oh yeah.
Hard worker. Hard work. There you go. So that's the third one. And again, no blood. You can see that we get some nice twitches, especially through the upper traps here. We'll do the same thing on the left side. So let's get you to turn your head over to the right to replace. Same thing, we're just going to clean off that area. And Jasmine, you can actually see some blood vessels in her neck, so obviously if you can see blood vessels, that's what you want to be avoiding as well. And because Jasmine's so fit, you can see all the big blood vessels here right along her neck. So obviously we want to avoid that, and just like I said earlier, we want to be avoiding the area where the lungs come from. So pinching that, again we got our upper traps on the left side here, and we're going to poke. And what we do with the needle is actually angle it away from her lung field. So her lung field's towards the chest that way. We're going to be angling up and away from that so that we minimize any risk of affecting the lung. That's comforting, right?
Can you puncture it?
You can't puncture it, but you can cause a pneumothorax. So because the lung is like several chambers, like a lot of different chambers, it can cause like a part of the lung to collapse on itself. Generally, it won't be the entire lung, it'll be like one chamber or another. You can think of like the Titanic, it's like a bunch of different chambers.
Oh, please.
I'm probably going to edit that part out.
Analogy.
Yeah, your lungs are like the Titanic.
Right.
Got many areas of failure. You see our left side not twitching as much. Is there one trap that's generally a bit tighter than the other?
It's all tight.
All tight, okay. Just a tight ball of mess. So usually when you come a little bit closer to the neck here, you can sometimes feel a bit more twitches. Good. So that we can go through this way, so this is considered the AP direction, so coming anterior to posterior. I can also do this with Jasmine flipped onto her belly, going from PA, going through the back side of her. So we just finished needling Jasmine's upper traps on both left and the right side. How did that feel, Jazz?
Good.
Yeah? Not too bad. So generally after needling, you do feel a bit sore. It does feel achy, usually for a day or so. Usually I recommend putting some heat on it to get the blood flowing into the area. So for Jasmine, what we're going to do is just test her neck rotation, so left and right for me. Good. And you can also do a side-to-side bend test. How does that feel?
Good.
Awesome. All right. So thanks for watching, guys. Hit that subscribe, like this video, and hit that bell notification for future videos. Gonna try to post a needling video every week, so stay tuned. Thanks.